Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. A couple of weeks ago, I made a video on NAC or NAC, N-acetylcysteine. It generated a lot of interest because of the antioxidant properties of it. Today, we're going to talk about quercetin, which also has a very high antioxidant activity. So let's go into some of the features of quercetin. Quercetin can be used as an antioxidant, anti-inflammatory, antimicrobial, as well as a immune-enhancing or immune-modulating supplement, as well as an antihistamine. Okay, so what is it? It's a bioactive flavonoid found in lots of fruits and veggies. So things like apples, berries, broccoli, grapes, nuts, onions, especially the red variety, bell peppers, tomatoes, etc. Okay, there's more foods than just what I listed there. So the clinical applications are things for allergies, viruses, neurocognitive changes, as well as cardiovascular disease and diabetes. Now, in terms of allergies, you can use quercetin with things like bromelain and stinging nettle leaf to enhance antihistamine effects. Okay. With viruses, you can use it with things like NAC or N-acetylcysteine and other supplements which I will list a little later on. Also, it helps neurocognitive changes because it helps improve inflammation and also has a cardioprotective effect. So in terms of cardiovascular effects, it has a cholesterol modulating effect, so it reduces high cholesterol. It reduces blood pressure or high blood pressure, as well as anti-inflammatory effects. So all those things combined has a decrease in cardiovascular risk, as well as neurocognitive changes. Now, there are different forms of quercetin that you can utilize, right? I just listed a few there. Quercetin is usually very well tolerated, right? Only people who need to be cautious are usually people who have kidney disease, where their GFR is very low. So if it's well tolerated, we can use anywhere from 500 to 1,000 milligrams in divided doses, right? In 2 to 4 times per day. So you can take 500 milligram capsules 2 to 4 times per day, or up to 1,000 milligrams 2 to 4 times a day. The half-life is about 3.5 to 7 hours. That's why you want to dose multiple times throughout the day to have the most positive effect. So when you're in allergy season, you want to use it more frequently to knock down the histamine effects. Or you can use it prophylactically very early on in terms of, let's say, getting a cold or the flu, right? The first signs and symptoms is when you want to really hit it hard with quercetin. Now, it also has a zinc ionophore effect. What that means is that quercetin enhances the transport of zinc into the cell membrane. That's why it can be a very important nutrient in terms of fighting viruses. Okay. Now, there are other nutrients that can enhance viral replication or help the immune system fight off viruses. So, in terms of the first signs of, let's say, a cold or a viral pneumonia or any types of viruses that you might catch during the winter months, right? Things like vitamin C and vitamin A is very important. Zinc, like I said, quercetin is a zinc ionophore. Astragalus extracts, Echinacea, licorice root extracts, Maitake mushrooms, lemon balm extracts, and I also like cordyceps for lung function. So you can use these in combination at the first sign of catching a cold or the flu, or the first signs of a runny nose or congestion. And you can ward off these conditions much faster in the disease process or the infection process of a virus. Today we're going to talk about quercetin and seasonal allergies. Here in the Northeast, the trees and flowers are blooming. and there's pollen everywhere. And this is when people get allergic rhinitis, runny nose, itchy eyes, etc. So how do we combat that? So during the season, we like to use quercetin. Quercetin consistently demonstrates the greatest activity among the flavonoids in animal studies for allergies or release of histamine. So it modulates the release of histamine from basophils and mast cells. Those are the two cells that release histamine into our bloodstream, creating that itchy, runny nose sensation. Foods high in quercetin: apples, berries, broccoli, cauliflower, cabbage, grapes, nuts, red onions in particular, bell peppers, green tea. If you cook these foods, it reduces the level of quercetin, so you want to have them raw when possible. Quercetin also has other effects: antioxidant, anti-inflammatory, anti-cancer, antimicrobial, and it's immune modulating. Quercetin works like a zinc ionophore, right? It pushes zinc into the cells, so it helps in the sense of fighting viruses. It prevents or inhibits viral replication. So zinc ionophores like quercetin can be utilized during the flu season, all right? I've actually made a separate video on quercetin and the benefits, so you want to watch that video and I'll link it below. So quercetin and seasonal allergies. There are different forms and some absorb better than others. Quercetin itself doesn't absorb readily, so there are different forms that can be utilized. Alcone anhydrous. You can use a form called a lecithin formulation. It's called a phytosome, where they encapsulate it into a fat, basically, so it absorbs better, up to 20 times better than just regular forms of quercetin. There's quercetin hydrate, and then there's also a formula called enzymatically modified isoquercitrin, EMIQ. And that's also more absorbable into our system. Half-life of quercetin is 3.5 to 7.5 hours. So you should take quercetin in divided doses. You can take anywhere from 500 to 1,000 milligrams, 2 to 4 divided doses during the day. Just during peak allergy season. You don't have to take this for long periods of time. It's just more for managing the symptoms of allergies. So you start with the smallest dosage, right? You go 500 milligrams twice a day. See if it makes a benefit. If it doesn't, you can bump it up to 500 milligrams 4 times a day, and then so forth. So you don't want to start with the highest dose. You want to start with the lowest dosage and see what's going to be beneficial for you. Now, there are other nutrients that are helpful for modulation in terms of circulation and inhibiting histamine release. Stinging nettle, butterbur extracts, mangosteen extract, ginger is another good one. Vitamin C obviously is good for our immune system, and vitamin D. So if you can combine quercetin and you can add some of these in, and you don't have to add all of them, but add some of them to see if you can have the most benefit during allergy season. Now, what I find most beneficial for patients is that when they get home, they shower, right? Rinse off all the pollen off their body so they don't carry it into their bed. Also, an anti-inflammatory diet can also be quite beneficial because it reduces the inflammatory load in our body. Therefore, if you do get allergens into our system, you don't have an overactive or exuberant reaction to pollen. So those are some of the strategies. Today we're going to talk about acute inflammation and quenching the fire, putting that fire out. Last video we talked about the inflammatory markers that you can utilize to see if you have inflammation. Today we're going to talk about supplementation and dietary recommendations. So, number 1, NAC or N-acetylcysteine. You can utilize 1,000 milligrams 2 times a day to decrease free radical activity. As you know, NAC is a precursor to glutathione and is a very important antioxidant. Quercetin, also known to quench histamine reaction, can use it for inflammatory processes. 1,000 milligrams twice a day helps to decrease leukotrienes. Resveratrol, 1,000 milligrams 2 to 3 times a day, decreases NF-kappa B. Turmeric or curcumin, you can use 1,000 milligrams up to 3 times a day, also decreasing NF-kappa B. Fish oil, EPA, DHA, in the acute phases, you can use 2,000 milligrams 3 to 5 times a day. It will increase anti-inflammatory prostaglandins and decrease inflammatory carcinoids. So it helps the inflammatory process by dampening it. These supplements you can utilize also for people who have chronic inflammation in smaller doses. So if I recommend 1,000 milligrams twice a day on a supplement, if you have chronic inflammation or chronic issues, or even maintenance doses, you can use 1,000 milligrams once a day or 500 milligrams twice a day. So you want to reduce the dosages. But if you do have chronic health issues and you really have a lot of problems, you probably want to work with a healthcare provider who can, kind of fine-tune the dosage for you for these types of supplements. Okay? So, anti-inflammatory. What about diet? Definitely want to reduce sugar or carbohydrates because sugar will spike insulin, and insulin spikes can create inflammatory processes. Partially hydrogenated fats. You want to reduce shellfish temporarily, red meats, and obviously processed foods. What you want to increase is water, fatty fish, and high antioxidant foods. Okay? Cold showers or cold ice plunges can increase endorphins, increase growth factor, increase circulation, and decrease inflammatory cytokines. So you can use this combination in a very short period of time, maybe up to 2 weeks, and then go down into what we call maintenance doses. And that maintenance dose will be dependent on your health needs. On the supplementation, I've actually made videos on each one of them explaining what it does. So you want to watch those videos. I'll link it below so you can watch those and give yourself an idea of how those things work in combination. All right? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome day.